the knowledge and to gain that how the things are moving around. And topic is also very good you have chosen, and really it is refreshing our knowledge. Thank you very much to the management of the organizer, and all the team is doing very good. So my best wishes with the team.
Thank you, sir. Thank you so much for your valuable words and your feedback. Thank you once again. If any other participant, if they also want to give us some suggestion regarding this STTP, they are most welcome. Dr. Amit Joshi, sir. Amit, sir, you want to share something? As I can see, you have unmute yourself. Dr. Amit Joshi, sir. Amit, sir, your voice is not audible actually. Can you please check that mic? As here it is not any issue. You can check by your side whether the volume is raised, because we are not able to hear you. Good morning, sir. Good morning, sir. Sir, please unmute yourself.
I need 5 more minutes. Just I'll start my lecture. Huh?
Okay, sir. Yes, sir. Sure, sir. Good morning, sir.
I'm driving. It will take 5 more minutes. I'll sit in the place and I'll start. Okay.
Okay. By the time participants, we will conduct that feedback session during this time. So participants, your feedback is important and necessary for the smooth conduction of this program. So,
ಉಪ್ಪಲ್ಲಿ ಒಂದೂವರೆ ತಾಸು ಲೆಕ್ಚರ್ ಅಂತ.
or at the end of the session, ma'am, we will give some time for the participants to share their feedbacks. So you can also share your feedback after the session of speaker. Meanwhile, if you want to share, Manoranjan Sahu sir, you want to share something? Or any other participant? I think Dr. Amit Joshi sir is facing some technical issue. So after the session, sir, you can share. If anyone wants to share right now, you can. They are welcome. Nagappa sir will be joining shortly. Within 5 minutes. So participants stay connected with us.
Yeah, good morning, all of you. Actually, really, I have enjoyed the program, particularly during this pandemic. Also, the sales group has arranged this STTP program for all of us, and this shows that the knowledge aspiring whatever these changes in our profession is required. So during this time, if we'll feel that instead of going there and through this audio visual round or through this visualized field, we can have this all sort of conference, and by that time we will also getting some of the knowledge and what should be, and many of the eminent speaker, they have mentioned in their lecture that what should be, what we have, and what we should have, and what we want to do, changes in our profession. That is really very enjoyable. I have enjoyed the program, and I will definitely inculcate in my resource whatever the things I have received from this program. I will definitely use in my development. Okay, thank you one and all the and I am especially thanks to all the sales group. They have very meticulously prepared the program, and finally today is the final day. Although will not be in together tomorrow onwards, but definitely I think in future also, if we'll want some information and for the sake of the career or for the sake of some of the R&D, definitely sales group will be with us. Thank you one and all.
Yes, sir. Definitely, sir. Thank you, sir. And also thank you for the kind patience you took meanwhile our sir is joining. So thank you to all the participants that they stay connected with us during this time. Thank you, Amit Joshi sir. As you has written, I congratulate the whole team. So thank you so much, sir, for your appreciating words. Thank you. Thank you, Saurabh sir. Thank you, Saurabh Sanghvi sir, for your kind words. Good morning, sir. So please unmute yourself. Nagappa sir, please, sir, you are mute. Please unmute yourself. Good ma'am. Sir has joined. Nagappa sir, but Yes, ma'am, you can start as we will. You can start.
Good morning, everyone.
Good morning, sir. Good morning.
Good
morning, sir. Welcome you, sir.
Yeah. Now, 10:30, is it I'm very late or I'm in time?
Yes, you are on time.
On time.
Sir,
Because I remember Priyanka ji has told that it starts at 10:30. So, this is that.
before starting, we would like to wish you a very happy birthday.
Thank you very much.
As I have just seen in your biodata that you are having your birthday on 25th December. So
one more thing you missed there.
Sir, so on behalf of Faith Group and SIRTP Pharmacy, wish you a very happy birthday.
One more thing you missed. My wedding anniversary is on 24th.
What is I'm not getting?
No, my wedding anniversary also
Okay, sir.
on 24th.
Sir, wish you a happy belated birthday and a happy wedding marriage anniversary.
The first wedding anniversary and after belated birthday. First I married on 24th and born on like that.
So with your kind permission, shall we start?
बारह पहले आनंद तो बनी ले
Please start. Okay. So good morning once again to all the participants on day 6 of AICTE sponsored short-term training program on interplay between health, wellness, environment, and community pharmacy. Today we are having with us a very eminent and renowned personality in the pharma field, Dr. A.N. Nagappa sir. Currently, sir is working as a director in MIT Institute of Pharmacy, MIT University in Gwalior, and sir is having a vast experience in academic and industry of around 35 years. Sir has completed his bachelor and postgraduate in pharmacy from Government College of Pharmacy, Bangalore in year 1978 and 1983. Sir has completed his PhD from Birla Institute of Research and Technology Sciences, with Pilani, from Rajasthan in year 1989. Till now, sir has published around 200 articles, in which 96 around articles in the international journals and the rest of the articles in the national journals. And sir has also published 2 books in pharma field. Sir has also played a crucial role in clinical trials. Sir has visited many countries for attending the seminar, conferences, and workshops such as Singapore, Malaysia, USA, Switzerland, Netherlands, UK, Turkey, Thailand, New Zealand, Philippines, Australia, Amsterdam, London. And Sir has achieved honor and with invited talk from University of Findlay, USA, from New York, USA, and in Bangalore, India. Sir has presented articles in various national and international conferences. Sir is a member of various international and national pharma bodies, such as a member of the International Pharmaceutical Federation, Netherlands. He is also a founder, president of Association of Community Pharmacy of India, member of International Society of Pharmacoeconomics and Outcome Research, member of International Society of Oncology Pharmacy Practice, New Zealand, member of International Pharmaceutical Federation, member of Indian Pharmaceutical Association, member of All India Pharmacy Teacher Association, member of American Studies Research, Hyderabad, member of Indian Pharmacological Society, member of Indian Pharmaceutical Hospital Pharmacists Association, New Delhi, member of Indian Ethno-Pharmacological Society, New Delhi, member of Indian Society for Surface Science and Technology, Kolkata. So, with such a vast experience, I would like to invite Nagappa sir on the behalf of SIRT Pharmacy and State Group in this university sponsored short-term training program. Sir, kindly enlighten our participants with your golden words.
Yes. Good morning, everybody. The present and future and past mission statement is pharmaceutical care everywhere. You may wonder why pharmaceutical care everywhere. Because the drugs we manufacture are not reliable, they are not safe, they cause injuries by deceiving us. It is not that you take the drug today and you will have a problem. It is not like that. You take the drug for 5 years, for what you're taking, that will be corrected. For example, if you're taking a drug for diabetes, it will control diabetes as long as you take. But in the meantime, it will also corrode it will also cause harm to other organs, other parts of the body. That's why in some areas we have targeted drug delivery systems, but these are not few, and the damage is inevitable. The allopathic medicine, if you are indulging, it is going to cause harm to you one or the other. It's 100% sure. So now, how do we manage this? Even in the countries like USA and even in Bangladesh, Pakistan also, for that matter, they are more smart than Indians. Don't get angry with me because it is a fact. We treat the drugs as grocery items. We take them without any cause or concern. We land up in problem and we ignore that. So many deaths are happening due to the abuse of the therapeutic agents, and nobody is taking care for that. Because ours is a big country, large population, a family of pharmacists, chemists and druggists. So as a young boy, I used to go and sit in the medical shop and see what's happening around. And usually, as a young boy, I used to be the cashier. So people used to come with prescriptions, without prescription, and so many things, the drugs were sold. Even the same practices you can observe in any medical shops. So this is the way we transact, and we are only serious about health when it bothers us. If it doesn't bother, we don't care for it. For example, many kidney disorders, people who succumb to kidney diseases, they are not knowing till their kidney is damaged up to 80%. And then they will realize that their kidney is damaged. Then they become very alert. They take so many precautions. It is like buying a ticket after the train is gone. What's the use? So they continue to suffer with dialysis and all other things. You must realize that what the nature has given, what the God has given, nothing can match with it. You go for the kidney transplant, you go for the dialysis, life is miserable. And also, if the people have no money, it is further miserable. Twice in a week, they have to go under dialysis. Even the transplant also that becomes miserable. So many drugs are given. Even in any therapeutic conditions, like heart failure or the COPD and the lipidemia. So many diseases we are given the chemical drugs. There is a big lobby behind it. The pharmaceutical and villains, I can call them villains, who act in a systematic manner, who make us to believe that we are safe in the hands of the current medical system, which is again a 100% lie. Why I am telling you that it's 100% lie? Because if you observe bit, you will be also realizing it. Doctor is a friend of medical representative. Medical representative is a servant of medical industry, pharmaceutical industry, and they are friendly with the government and regulators and whatnot. So all of them get benefited, even pharmacists also. Why should I leave pharmacists? They also go. So all this have joined the hand and are exploiting the patients. Who are these patients? It may be myself only, or it may be someone else. Can you please change the slide? Madam, can you please change the slide? Yeah. So the key terms are community means what? Community pharmacy is what? So our talk is about the community pharmacy, and practice means what? So community is a group of people living in the same place or having, for example, you live in a village, you live in a locality, that is the community. So where you can, you are identified as a professional. It may be doctor, it may be dentist, it may be pharmacist, it may be nursing professional. So pharmacy, the branch of health science dealing with the preparations for dispensing and other things. So this is the way, and the practice is very important. Please don't ignore this. The use of one's knowledge in a particular profession. So who are these in the forefront of the patient interface? Whom we have put the diploma holders and family members, and they are going to talk about the drugs to the patients. What a nonsense. And the person who has studied diploma in pharmacy, graduate in pharmacy, and the postgraduate in pharmacy, all those people who have the knowledge, they are sidelined by this thing. Who are responsible for this? The regulator. That's why I called the regulators are the culprits. They have to be very strict, like in other countries. They should make the pharmacy profession ever. They are most of them are pharmacists only. Who will become drug inspector, drug controller, and all these things? In fact, in the state of Maharashtra, Dr. Jigade, who is not a pharmacist, Jigade is not a pharmacist. He made a revolution in the pharmacy practice, pharmacy profession in Maharashtra. He is an IAS officer. He said that your Drugs and Cosmetics Act says that the presence of pharmacist is mandatory and he must be there. Otherwise, I will close the shop. He started in that. What happened? The whole pharmacy profession awakened, and he made it compulsory, mandatory. Pharmacists should be present. So outcome is very wonderful. The pharmacists who are now at all recognized by anybody in the society, they got a recognition, they got a position, their salaries were increased, their working hours were improved. So the word pharmacy started getting heard in these circles. So this is how the law is there, the rules are there, regulations are there. Who has to implement? Who has to follow? Who has to practice? It is we. We are also very corrupt people. We don't subscribe to that. We don't do any such attempts to do it because nobody is doing. You ask why are you not doing? No one is doing. Why should I do? See, is it the answer? See, a patient comes to your shop under the belief that there I meet a learned pharmacist who will give me the information about drugs, who will take care of me, my health? So where is that? What is happening there? Transaction of money. Somebody is like any grocery shop or any this thing, he will pay the money, he'll collect the medicine, and he's been so much systematized. He is so much perfect that he doesn't want to talk to any pharmacist. After the transaction is over, he will run away from the shop. He doesn't want to spend time there. He feels that it's a waste of time standing there and asking some questions. So this is the tendency he has there. If you look at the pharmacists at the abroad, I'll give you a live example. My student, Pradeep, is a B Farm from Harapanalli. He is of my age only, maybe 1 or 2 years junior. So I was also very young. So he did his diploma in pharmacy and then bachelor in pharmacy and masters in pharmacy and migrated to Canada with his wife. And he settled in the province of Vancouver in a small village, Kamloops. Kamloops, he established his pharmacy, you know. So he and his wife are working as pharmacists in their own independent pharmacies. And what a respect he commands there. So I happened to be there once and saw that people are standing in queue to go get the prescription medicines. And also, important thing, the pharmaceutical care, means the counseling. People want to talk to the pharmacist and learn about it, because they don't want to go home and get into trouble about very, very simple things, how to use medicines, how to store it, what are the side effects, and what happens to them. All these minor things, the pharmacist, they want to hear from the mouth of a pharmacist. So the pharmacist gives them the complete patient counseling and dispenses. So patient counseling is a mandatory thing which has earned a big name for the pharmacist. So if you look at this thing, that in USA, the number 3 position or number 2 position, the community pharmacists always ranked. Why they are ranked like that? Because they do a very, very important service. Because prevent so many drug related issues, patients are kept safe, many hospitalizations were prevented by their intervention. So this is how the pharmacists are contributing to the society, and then they are known for that. So can I have the next slide, please? You can run 2, 3 slides. So just what is this in between? There is something, can you remove that
The next
box?
slide.
Okay, now it's okay. So now that should do. Research, go for the previous slide. Go for the previous slide.
1 second.
Yeah, in that this box you remove. There only get this one. Go to next slide. No. This is pharmaceutical care. What is pharmaceutical care? Why we should give importance to it? See, in the developed countries, they earned a name because of the pharmaceutical care. What is pharmaceutical care? So you have to take the responsibility of the patient, because he is the person who has given you business, who is giving you the money for survival. It is not just likely that you want to give theoretically pharmaceutical care. You must be sincerely, you must you must see that what medicines you are dispensing, what side effects it has got. You must inform him that this drug causes the drowsiness. So don't take it in the daytime. Don't operate driving or any other machine related operations while you take this drug, because if you take this drug, there is a chance of getting an accident because of residence. So this is the care and this is the intention. See the why doctors are in our country are so much adored, so much loved, so much respect they are having because they work intimately with the patient, they care for the patient, they see that the patients are suffering. Even nurses also do the same thing, but pharmacists are nowhere doing such things. So the although we have the knowledge, we don't we are not confident of our knowledge. We don't put into practice. I've seen many of my friends in themselves, pharmacists, they don't know what is the use of the knowledge. And like that, they also end up with any other common man suffering. They also, their families suffer, they also suffer, and they don't use the knowledge for what is given to them, what kind of side effects it may cause, how it going to harm me if I don't take precautions. So these simple things, which we have studied for so many years, we only use it for our job. During jobs we use it, but when it comes to the practice, we don't do it. That's why in 2015, the government of India came out with um, a law that pharmacy practice guidelines 2015. So if you visit the BCI website, there is a law, pharmaceutical pharmacy practice guidelines 2015, and many other state governments also adopted it. And now law is there. There is no power in that because nobody is interested to practice it. So as a result of it, the laws have come. It is a loss because nobody practices it, and we continue to suffer because of the non-availability of pharmaceutical care. So I am talking with so confidence that pharmaceutical care everywhere should be there because there is a reason for that. I have seen going to the Pradeep's experience in Vancouver, Kamloops. I observed that the he was before he talks to the patient quickly. He undergoes the medicines been prescribed. What is the medicines been prescribed? What is the lifestyle the patient is having, and drug, disease, and lifestyle. So he make a quick assessment of the individual patient, make a customized requirement of the patient, and then appropriately handles him and advises him along with the medicine. The patient will go. But again, it will not end here. He will call the patient again after 15 days. You please come and see me. The patient will come out after 15 minutes, after 15 days, after 15 days, and observes for the changes due to the treatment. If there are no changes in the treatment, then it is a waste. What has happened to the patient? Why he is not responding to treatment? Where it went wrong? Who has to look? This is the job of pharmacist. And if he finds there is a problem in the nursing care, if there is a problem in the drug therapy, immediately he gets alert and he informs the doctor, he informs the nurses what is happening to the patient, and the doctor also go through that and review it and corrects it so that the treatment leads to the relief of the patient's condition. So we have seen in diabetes and hypertension, people are taking medicines, go to doctor religiously, and also go to the lab religiously, get their blood tested. Blood results are there, reports are there. They are afraid of going to doctor. If it is wrong, if H1VAC value is done, they will never go to the doctor because they know that the doctor is going to take a advantage and emotionally blackmail the patient. Means he says that why this much of sugar, why you are not taking care of your health. Like that he plays a emotional drama, emotional blackmail, and patients never opens his mouth. He wants to keep his suffering himself. He will not tell to the doctor. It is not always, but commonly we see it. Commonly we see it, and as a result of it, he becomes more slave to the doctor. And although he is paying for money for the treatment, the not having any good outcome, gradually it ends up in the complications of the disease. For example, why there should be, if the patient is under treatment of diabetes, why he should, why we are getting so many cases of retinopathy? Why we are getting cases of heart failure due to diabetes? Why many kidneys are failing? Why there is a diabetic foot? Lot of diabetic foot cases. This is due to the failure of the system. So the doctors, they will prescribe medicines, patients will take, and no one will tell them in a clear manner, and there is no documentation, there is no accountability. The patient uses the medicine, but ultimately it is not effective because there is no monitoring in that. So somebody should monitor what is the use of the medicines, how they have been helpful to the patient. So that is not been done, then the patient continues to suffer. So here what I emphasize, the pharmaceutical care is a very important aspect of our professional practice, which can bring a good name to pharmacist, and also there can be many good outcomes, and patients are very safe, and they don't suffer from complications of the drugs or the disease or any other thing. So can I have the next slide, please? So I want to share you some of our experiences, some of the experiments we did in Manipal. So I spent 10 years in Manipal. So during that, I established a NGO called as Association of Community Farmers of India. Even today, we are working on that. So in Gwalior also, we go every Sunday morning off, and to Jivaji University, Gwalior, and there we have got an opportunity in the health center to counsel the patients. So we are counseling the patients and about the how to use medicines, what is the role of medicines in therapeutics, all these things, and you must be listening. So at the end of the not at all required, and using medicines is not a safe practice, and you should always take care of your own near and dear ones about prevention of the ill effects to the health in a long run. So further, what happened is there we go there, and our advice mainly based on lifestyle changes. Like you must be wondering the the first thing everyone has to follow is to practice meditation. Meditation relieves all the stress and anxiety, and also it releases the positive hormones, and curtails the negative hormones from the brain itself. So when the brain have adequate rest and repose, it will lead to the relief of the tension. Adrenergic system will come down, and the cholinergic system, will so rest and repose. And what is the outcome? I myself was a severe hypertension patient. So gradually, I have given up the blood pressure. Anytime anybody measures my pressure will be 120 by 70. See, this I achieved it by practicing half an hour every day. So we must convince the patient that meditation you must practice. Not only the blood pressure will come down, so many positive health effects are there in the meditation. So we must help the patient. And also there are institutions help the patient to learn this thing even free of cost. There is a center called as Vipassana Kendra. You can check in your internet also. Vipassana meditation. One of the philanthropists, Mr. Goenka, he has established it. And through that, he will teach you 10 days residential free food, free training, all this thing. But the training is a bit tough. But one has to go 10 days program, basic foundation course in meditation, and it will cut off the medication. I was surprised to know that the many of the symptoms, many of the lab reports who are going uncontrolled and using medicines to control them have come down. But uh, I have to do an experiment with a report, then only people will start. And already so many people have done experiments and there are reports about it. This is about the meditation. And yoga also has got several positive effects. And this is why we must go for a healthy society means we must rely on the yoga, meditation, and pranayams. These are the three things which I must recommend to every patient so that the patient learns about it and lives a healthy life and cuts down the dependence on the drugs. I was told that the drug like aspirin, what kind of side effect it can have over a long period of time. Low dose aspirin, we use it for the as a protection against heart attacks or heart related problems. So although it keeps the blood in fluid state, but in due course it is going to cause a cerebral hemorrhage. You must read, you must go to the YouTube and see the Dr. B.M. Hegde. Dr. B.M. Hegde, who is a very, very learned physician and has worked in several these things and have written many of the things. So he says that all the activities of therapeutics or the drugs and all these things run around money. They are seldom they care about the patient welfare. So that's why we must not rely on these things, and we must try to do the regular lifestyle changes. The lifestyles can greatly impact the change the scenario of the patient condition. So now the next slide, please. So now the pharmacy and its branches. Let us go. No, skip this. I don't want. Many of you are knowing about it. Next. Okay, next. So this is our new Gazette of India notification about pharmacy practice. Please look at, read it carefully. It came into force on January 15, 2015. So now we have lapsed 5 years. What is the outcome? In 2008, we have started a program called as Farm D. And where are these Farm D people are going? They are going to industry, they are getting jobs, they are happy. So what type of, for what they are, the course is started to begin pharmacy practice in the country. Where it has led? It has led to this thing because there are some regulatory lapses. They should have created the clinical pharmacist job in the hospitals. Clinical practice should start. So one is the inaction, means the deliberately not taking care. The people who are in the helm of affairs, they don't bother. So their laziness has led to apathy condition for the PharmD people. PharmD students, they are finding a good jobs in the industry. We did not we did not introduce this course for catering to industry. For catering to industry, B Farm is there, M Farm is there, PNT is there. This is a purely patient oriented, service oriented, pharmacy practice oriented qualification, which is not been uh, put to proper use. So this is how the things are misled in our country. Can I have the next slide, please? So this is the definition and all. Practice means what? Practice of pharmacy. So what is practice of pharmacy? last line, we will read it. Interpretation, evaluation, and implementation of the medical order dispensing prescriptions, drug orders. So let me elaborate. The dispensing of prescriptions, we understand medical orders means in the military and all those things, there will be medical orders, and also the drug orders also in the military. So this is the interpretation, evaluation, and implementation. So participation in drug device selection. Any pharmacist in the country is allowed to select a drug for a patient, and what type of device is this thing. Device, we also don't know what is device. Medical devices selection, not at all, because we are clinically offline. We are not engaging ourselves into clinical practice at all. That's why all these things are appears to be very this thing. And drug regimen review. What is drug regimen review? Doctors prescribe a prescription and tells about what duration that treatment should be taken, and how the medicines, how many times the medicine to be taken. So many information is written in the prescription. But it should be executed, Someone should watch what is happening to the patient, whether he's understood, whether he's using the medicine as properly diagnosed and directed by the physician. Actually, single physician is now out of fashion nowadays. Team of people, nurse, doctor, and pharmacist, all the three of them will act on the prescription and write a prescription. After writing a prescription, drug regimen review should be understood, and what has gone wrong should be corrected. So drug or drug-drug interactions is another one, drug-related research, because the patient may respond in a different manner. A patient, you although intend to give a drug for the control of diabetes, but it is causing the respiration rate increase, it is damaging the kidney, it is damaging the heart. Such instances have come out. So revision is very, very important. Observing the patient, what is happening due to therapy. Next. Can I have this next slide, please?
Sir, this slide or next slide?
Next slide, madam.
Sir, is this
Yes, some vendor here. Now, the one more important point is, why should we do this patient counseling, patient care for free? In other countries, they get more money for the services. Sometimes government itself pays it, encourages it, and sometimes the patient himself will pay. So this free of service to the patient is not expected. Even patient are also willing to pay for their services. But what has happened? There are due to lack of leadership, nobody is asking the right questions, and they think we are losing the time, and we are living a low quality of care, low quality of life due to our carelessness. I can tell you, pharmacists are careless. That's why the wrong practices are going on, and nobody is taking care of that. Nobody notices it, and they turn a blind eye to it. The things happening wrong, you turn a blind eye to it. You don't take care of the things to correct. So as a result of it, these things are haunting our this thing. So I know that my friend, Mr. Sridhar Bhatt, my classmate, Mr. Sridhar Bhatt, has told me that in Australia, for doing the service, the government pays him the extra money per prescription. around $5, $10. So how do they pay? Due to the pharmacist is kept under the CCTV camera, and what type of counseling is made it is been recorded, and accordingly the exchequer, the government sends the money to the pharmacist. So such a system is possible in India also now because it's digitalized and all these things. So government has to take care and see that the pharmaceutical care becomes normal like in any other country, any other developed country. So in America, the patient is charged for the providing the service. They have written on the board patient counseling for 5 minutes, for 10 minutes, for 15 minutes, for 20 minutes. People, they willingly pay. They will not, for the saving money, they will not skip the advice. They say that we need the advice because it is valuable. It is matter of health. So I would like to recall one statement. If the money is lost, nothing is lost. If the health is lost, something is lost. And if the character is lost, everything is lost. So we have to feel in the minds of the people that health is very important. If you lose the health, then you will have a problem which cannot be solved. So please, friends, you are pharmacists, you please take the leadership and you please see that the in the country we develop pharmacy practice as a as a normal thing by as my mission statement, pharmaceutical care everywhere. So can I have a break for 5 minutes? You can ask the questions to the delegates, ask them to type the questions. So I would like to put
Yes, sir.
questions.
Yes, yes, sir. Sure,
Just
sir.
5 minutes, exactly 5 minutes. Like,
Okay.
we can continue. So in the meantime, you please throw the questions to the, ask them to come out with the questions because it is better if I know what the delegates wanted to learn from my experience. Okay, I've given the other few more points are there that I'll cover after this, but they should also give an opportunity to express their views, to ask for doubts. So my break starts now. I'll come and join you after 5 minutes. 11, 12, 11, 17, I'm back.
Okay. Okay. So participants, if you have any doubts or questions, please you can write in the chat box. So within a 5 minutes, sir will rejoin us. By the time, if you have any doubts or if you want to share any views or experience, you can share. Or if you have any doubt, please write in the chat box so that sir will resolve your queries after 5 minutes. After 5 minutes, sir will rejoin us.
Yeah. Thank you for the giving me a break. Now I'm ready. Shall I begin?
Yes, sir. Yes, sir.
Now I will talk about our own experiments, which you can also learn really easily and do. These are the things which we tried and had a very excellent response from the patient community. What are those? I would like to tell you. See, in Manipal, I had surrounded. Manipal is the educational town or educational hub where Manipal University offers all disciplines of the courses and other things. So in that, we have in 2008, we established the Association of Community Pharmacists of India in the pharmacy practice department. So I was the head of the department, and I took the advantage of being head of the department. I said, everybody, first we had in that time MPharm in pharmacy practice. So 24 students and some staffs were there. So 30 people, I said, everyone should take a membership in the Association of Community Pharmacists of India, and everyone have contributed 100 rupees in those times, 2006 and 2007. So with that, we had 3,000 rupees. So we got registered the society, and we appointed an auditor, and we started providing services to the people. So the first one is in the medical shops, in the Manipal hospital who have seen, in front of it there is there are several medical shops are there. One of the medical shop belonging to the Premchand Pai, who was an alumni of the Manipal College of Pharmaceutical Sciences. When I went him that we want to do evening patient counseling, he said, okay, come and do it. So we took a small table, and then we bought the BP apparatus, hemoglobin apparatus, and the blood glucose monitoring apparatus, height and weight measuring devices. So all these things costed us nearly 5,000 rupees, and we started giving the pharmaceutical care. So when we started, the people were very much suspicious about our sitting there. They thought that we are selling some products to them. They used to run away. And it happened for 2 weeks. And all my students were very much angry because evening they had very good engagements. They wanted to go to sport. They wanted to do that on this one. What is this thing? The SHY is doing us, forcing us to come in this thing when nobody comes there and all. I also started bothering why this is happening. Then I struck to mind. So I asked one of the students to make a small poster that the services of BP and the BMI and the other one is the blood sugars are free. When the word on the billboard appeared on the screen that it is available free, there is people started queuing up. And when we measured it, during the measurement, we also took a interview of each patient. I said, why you have come to the hospital? What is your botheration? What are the medications you are taking? So when we learned that, and then we took their phone numbers also, and say that we will contact you and give you the information. So I observed, gradually I observed that many of the students of a university, women and aged person, are coming to medical shop to buying the painkiller medicines. So as a result of it, you are taking painkillers. They also don't know how much water they should drink. So we used to tell them, you have to take nearly 350 ml of water, more than 1.5 glass of water whenever you take a oral medication. And one of the patients asked, why should I take so much of water? I will hardly take one small sip and drink. Why are you asking me to drink? I told him that when you take with a sip of water, it is going to lodge in the stomach. A drug is released in a very high concentration. It may cause harm to your mucosa of the stomach. So if you take large amount of water, it is going to help you. And that's why we use the dissolution test. Can anybody tell me how much volume we use it in the dissolution test?
Approximately 900 ml in CRP.
Nearly a liter, isn't it? You're right, nearly a liter. So 350 to 400 ml.
Yes, sir.
Whenever a tablet is taken, it should be consumed along with the tablet. And water consumption is very, very important. If you drink more water, it is going to be more safe and you are going to be more healthy because water cleans the body out of the waste products accumulated in the body. So usually now people are telling that you need to drink 2.5 liters or 3 liters of water. So check how much water you are consuming. You want a healthy kidneys, should drink plenty of water. So please, and also inform people to drink plenty of water. Water is a medicine, and that because it's available free, and we don't recognize the value of the quantity of the water we drink. So please, friends, propagate this safe measure to the very patients. Then the other things that I told you that taking painkillers. Okay. And the painkillers are going to damage kidney and also make the blood thin. So many side effects are there and pain is relieved. And they have to come every time the drug goes out of the body because the effect is short-lived for 8 hours, for one day or something like that. Then we thought, what should be the reason of this backache? We realized that many of their food habits are very, very artificial. It is deficient in protein. We also found out from the literature that 30% of the diet, whatever one eats, should be made up of proteins. Then where are these proteins? How to get them? Again, if you ask any doctors or anything, they will say you go and buy that Ensure or such thing like that. So it is also wrong. It Ensure costs you nearly 600 rupees. Then I said that you should take the proteins in the form of lentils and legumes, dal. You consume dal more. Within a week, your backache is gone. And the students also were very much curious. They asked, where do I get to do all these things? I don't have time. And all. I said, you buy half kilo of moong, the green gram. Take a fistful of green gram and put it in water while sleeping down. In the morning, you eat it, and that let to be the regular menu of your everyday breakfast. Within 15 days, most of them stopped visiting medical shops for backache. Is it not a good intervention? Isn't it? So like that, then one of my colleague, he had a very chronic acidity. Chronic means very chronic acidity, and he has been fed up. Since 10 years, he was struggling to overcome the acidity, he was not able to come. Then I said, why Dr. Dr. Rajan Surveli is a very famous professor in pharmacy practice department of MCOPS, Manipal College of Pharmacy. Dr. Rajan, why can't you try the green gram? Oh, no, sir, it will form gas and all. Don't talk rubbish. Common man will say gas. What is the gas for us? So acidity, see, this is all your mental makeup. Let us go scientifically. You take one fist of full of your green gram for 1 month. So he followed 1 month, his acidity is gone. So the logic was from my side was, see why acidity comes. What is the purpose of acid? Anyone can tell me? It is the first year B Pharm, first semester logic. Why acid, gastrochloric acid is hydrochloric acid is secreted in the stomach? What is the purpose of it? Anyone can answer.
So digestion, sir. Purpose of
What
this is
digestion? Digestion of what?
Food, sir. The ingested food that is turned into the liquid so that it can be the nutrients can be absorbed.
What type of nutrient it acts on?
Yes, sir.
You have to give further details, sir.
Okay, sir. So, sir, its basic purpose is to liquefy the foods, and from that food
That's
we
it.
can.
No, no. I want to ask you. You have got hydrochloric acid. You put your food.
Yes.
Will it liquefy?
Sir,
What is the
antimicrobial
pH?
activity.
Huh?
Antimicrobial
Antibacterial.
activities.
So there are a lot of bacteria in the stomach. Do you think? So food you eat like
Yes.
get lot of bacteria.
Sir, food. Sir, harmful bacteria which comes with food.
Food when you make it fresh and this thing, does it have any bacteria? Fresh sambar, fresh roti, and fresh sabji. You got a lot of
but it,
bacteria.
sir, but,
Oh,
sir, it may be harmful bacteria can comes with the foods.
no, it is very artificial thinking. If you are really bothered about the patient, you will really think straight. Start thinking straight.
Okay, sir.
Tell me the answer.
Sir, acidic environment can create the, मतलब it will rise the protein bond, peptide bonds present in the protein.
So some logic has appeared. See, we eat food in various formulations. What is the basic of the food is it is either protein, either it is carbohydrate, either it is fat or nucleic acid. Okay. So protein are complex molecules and cannot be broken down in the non-acidic media. That is the purpose of gastric acid secreted. And why? Because the gastric acid brings down the pH and there are some enzymes in the stomach which
Pepsin
get
and gastric lipids.
activated. Yes, you're right now. That way you have to think. So pepsin and resin, they get activated and they will break down the protein. So whenever you eat protein-rich food, you don't feel hungry. You don't feel hungry for 2-3 hours. Whereas you eat only rice, you will feel hungry after half an hour. Why? Tell me, gastric emptying time, why it varies? When you eat a liquid diet or a plain rice, curd rice, within half an hour you feel hungry. If you eat lot of dal, you will not feel hungry for 4 hours or 5 hours. What may be the reason?
Yeah. Protein, it will take some more time, protein as compared to carbohydrate, I think.
How the stomach will realize this? You have eaten protein or you have eaten carbohydrate?
It's protein.
How it understands?
Yeah, that's a very good one.
Actually, there is a neuronal feedback mechanism. The chemistry of the food is sensed. And accordingly, the gastric emptying time is varied. It is the brain and stomach
Yes.
are
For
in
protein food, it's different, is there?
constant talk, constant dialogue. What kind of food is there in the stomach? So if it is protein, it will delay the gastric emptying time. If protein is not there, it will easily reduce the
Yes.
gastric emptying time. So this is how. This is the
Right.
knowledge. This you have taught your students. So this one should be applied in the therapeutics. Now you know
Yes.
that the protein, when you give, they are converted into amino acids if there is acid. So the person who is suffering from chronic acidity, because he is a South Indian food, his wife also cooks very nice idlis, dosas, and whatnot, pulavs and all. And hardly he was eating a 5% of protein. I checked his diet chart. I asked him to what all eat. Then I showed him that you're eating only 5%, whereas the normal requirement is 30%, 33% of the diet should be proteins. So I asked him to increase the proteins. So gradually he ate for 1 month the green gram and his acidity is gone. His acidity is gone. which was not solved by gastroenterologists, and all these people were wondering. So this is the way I treated. And third patient came to me, a villager. He came to me that he has obesity, his BMI is increasing. Doctors and all have given him the verdict that if you don't reduce your weight, there will be big problem. And the same problem, the diet problem. He was eating, he was growing in his fields the green gram, Bengal gram, and all these lentils and legumes, and he was selling in the market, and he never used to cook and eat in the family. As a result of it, lot of carbohydrate accumulated and led him to the obesity. Because when you eat starch and it is converted into fat in the liver. This is a common knowledge we give to our students. So balanced diet is not there. As a result of it, he is getting obese. And doctors have written all kinds of the statins, other thing. And the weight is not reducing. So when I said that you increase the protein in the diet, after 6 months, the villager was very obedient and very sensitive. He changed it and he made it, and one fine day he came and stood in front of me. We run this program as long as I was in Manipal. Now I don't know. 8 years. So after 6 months, the farmer came and sat in front. Sir, do you recognize me? Because who will remember? So many, every day we used to see 30, 40 people. On average, 40 people we used to discuss. Sir, I'm the same person who tell that you have to eat moong every day and eat less rice. And I did the same thing. My weight is now perfect. My BMI is perfect. See here, the simple thinking application of biochemistry knowledge has led to wonderful results which we can proudly say in any way. So then what happened in due course? The people I got very much impressed with the moong dal and moong sabut, and I used to tell everybody, you eat moong, you eat moong, you eat moong. So after eating moong, they got relief from their problem. Naturally, they have to get relief. When there is not there, then they get relief. And then whenever I used to go in the market on half days of the thing, the people used to see that the moong doctor. And I got a nickname like I'm a moong ka doctor. And moong is really having very wonderful things. And we advocated it, even you, today also I advocate it, because the moong will give you a very good protein value for the in the diet. So any dal is also good. For example, in the north they make on sattu. You know sattu. What is sattu? Have you heard? It is a processed chana dal. If you go to Patna railway station, you find the coolies lifting very big weights. I wonder how can they get so much of strength. Then I realized the secret that they used to eat sattu, especially in the winter. They used to eat more. As sattu they ate, the protein deficiency is over. Proteins are body building things. They are essential for the muscles. They're essential for hormones. So many things. So when they took this, then I also tried in Gwalior. So available in the market, I prepared this thing sattu, and it's a value-added food, and you must advise the patients like that. Instead of it, you go for Protein X and this what is that? Another powder is there. So all these artificial proteins is a waste of money and doesn't improve your health also. So you must understand why the doctors who are treating hyperlipidemia, overweight, BMI reduction are not telling this secret to people because self-interest. It will spoil their business and they'll out of business. According to me, one of the thing I tell you, another interesting story I got in my mind. See, it is Sajeev Nair, a management consultant. In his lecture, he reveals like this. So, what happens? A person gets a bad knee, means the knee pain, knee joint pain was very horrible. Then doctor, orthopedician examined and everything went well. And he said that you come to me after 15 days, your knee is very hopeless. I have to operate it. Otherwise, you will become permanently not able to walk. Knee replacement therapy I will make. So this man agreed, and also he also learned that the knee replacement therapy will make him like an ugly duck. He cannot walk properly naturally. Natural thing is lost. So what to do? He was worrying. So he shared his worry to his friend. His friend told that, see, I have got a remedy for you, where you don't have to go for a knee replacement therapy at all. What are you talking, man? So many doctors having degrees, everybody is told that knee replacement is very essential now. Otherwise, I will suffer more. So, a lot of fear was infused into the patient's mind. Even it same happens when you go for the cardiac treatments. They infuse fear systematically, and you never suspect that they are infusing you the wrong things to your mind. As a result of it, this man said that I know a remedy for that, which you have to take it orally, and that knee will be all right. What is that? Then he gave it, and this man uses for 2 weeks, and knee becomes normal, and he starts walking properly, and he forgets the knee joint pain at all. So now the problem is the doctor has scheduled the meeting, and he is not having knee pain. Now he want to avoid the doctor. So whenever the doctor is there, he runs away. He covers his face and he avoids the doctor. So once it happens during going in a lift, आमने सामने आ जाते. The doctor says, "What happened to you? Why are you not coming? Did you get it operated elsewhere?" "No, sir, I never got it operated." "Then how come you are all right? I have studied your report. It's so worst at all." "No, sir, my friend gave me a powder. I took it. Now I am all right." "What is that powder?" He said, "Glucosamine." And doctor was silent for a minute, and he said, "See, you don't tell it to anybody. If you tell it to everybody, then I will be out of business." So this is the way. One-to-one education, glucosamine came into prominence, and it has replaced many knee care replacement therapies. So this is the way in which the medical science is so selfish and so self-centered. They care for them, although the patients believe them. They give their belief is, they say that Narayano Vaidyavari, doctor is God. See, that statement, the patient believes and the doctor deceives. This is not good. So, because there is no accountability, there is no documentation, and nobody to catch them if they commit a mistake. So, under this guise, they are looting the people, which I hate. Which I hate. And you should also hate. Everybody should hate that. So, this is the other one. And one more story I will tell you. We were going for that is the camp where we used to do all these things, Moonka Dr. Koga. And then we started that we should visit the patients' homes. Then on Sunday, every Sunday, after breakfast, we took our equipments like BMI, weighing bridge chahiye, or measuring tailoring measuring tape, and then BP apparatus. All these things we took, and we used to go to the various homes. So among the homes, we came across a senior citizens, both husband and wife. All children are in abroad, and they were alone. Means they are both are living in the house, and wife is bedridden, and she cannot move. And this old man, who is also weak and having suffering, and he was. This is the state when this is what we say, what we saw when we went to their home. Then what happened? I asked them to show the prescriptions. We told that we are all having apron. They get confused that we are doctors from KMC, Surva Medical College, and they treated us like different drugs names and other things. And I told you, where did you get this? Sir, I got one from the general physician who is in the corner here, and he has given it. And one more is my friend's uh, there I got it. And so now what happened? The patient is having nutritional deficiency because the food is very, very, as usual, Indian diet, more in carbohydrate, less in protein. And then B complex, can a B complex can solve the problem of malnutrition? They are malnutrition. So then we said that the moon formula we gave them, and we used to go once in 15 days. Next time when we go there, the wife was very active, and she was moving all the moving around the house, and the husband also was happy reading a newspaper and having a cup of tea made by his wife, and they welcomed us like we are the legendary doctors. And they said that within a week her pains went away, she became active, she is all right now. See, the mistake of the healthcare system that did not advise them properly. So then what happened is the wife insisted that she made tea for all of us and gave us tea and thanked us for correcting their ignorance and making them healthy. The remedy मूंग दाल घर में ही है. एक कहावत है, घर के दाल, घर का मुर्गी दाल बराबर. So whatever the value food we have to use it. We cannot neglect it. I think, how much time do we have? Yes? How much time do I have?
Sir, sir, you have half an hour more.
So again, I need a break in that case. Okay?
Okay, sir.
Thank you. Thank you for giving me a lot of time.
Yes, sir.
So I will start after 5 minutes. It is
Yes, sir.
11:48, 11:53 I will start.
Okay, sir. Sure, sir.
Participants, sir will be joining within 5 minutes. So please stay with us.
Hello, I'm back in the meeting. Can you hear me?
Yes, sir, you can continue.
Okay. So you move the slides now quickly.
Yes, sir.
So all of you should read the pharmacy practice guidelines 2015. It is available on our website. You can download it. I'll show you later. So what is this? Okay. So what are services are there as a pharmaceutical care? Overutilization and underutilization of medicine. This is a common problem you come across in the therapeutics. Somebody has been given drugs, whether it is required or not. We the pharmacist should check. Like in the vitamins, in the previous case, they are prescribed vitamins which is irrelevant, and it is not at all helping the patient to get the strength. To get the strength, one should have the balanced diet. So that one we have to